Alors, bonsoir à toutes et à tous. Bienvenue à cette conférence de presse du Premier ministre François Legault, du ministre de la Santé et des Services sociaux Christian Dubé, ainsi que du directeur national de santé publique, Dr Horacio Arruda. Monsieur le Premier ministre.
Bonsoir tout le monde. Avant de vous parler de la pandémie, je veux dire un mot sur ce qui est arrivé à M. Camara. J'ai été touché, comme beaucoup de Québécois, de la façon qu'il a été arrêté, détenu pendant 6 jours. J'ose pas imaginer ce qu'il a ressenti, ce que son épouse et sa famille ont ressenti. Donc, dès ce matin, j'ai demandé à la ministre de l'Immigration de s'assurer que dès qu'il y aura les papiers pour la résidence permanente du gouvernement fédéral, que le gouvernement du Québec émette un CSQ, un certificat de sélection du Québec. Je pense que ça peut venir un peu atténuer.
So I think that it can mitigate a little bit the prejudice that Mr. Camara has suffered, unfortunately. I'll come back to the pandemic. You may have noticed over the past few weeks, the days are getting longer. I think that even now, there's still a bit of light out. And why? Well, because spring is coming. But winter has not finished. We will still have a few storms, a few snowstorms, and it's about the same thing with the pandemic. Things are improving, whether it's cases, hospitalizations, or deaths, but the pandemic is not over. There are still some risks, significant risks for Quebecers, in particular over the next few weeks. So there are several reasons that push us to be very prudent in the actions that we will undertake over the next few days. The first thing, well, the situation in hospitals. You can see there are still 771 patients, COVID patients, in hospitals. That means that there are still some surgery postponements, so there are some surgeries that are being delayed. And we have a waiting list that is long, and we need to reduce it. The second reason why we have to be prudent is that we've got nurses and staff who have been on the front lines for 11 months. They are exhausted, and we must continue every day to think about them. Third, there's also the variants, the so-called variants. Later, Dr. Arruda will talk to you about this. There's an increase in the number of cases of the UK variant, the B117. This is a variant that is more contagious, so if we're not careful, the number of cases could explode in just a few weeks. So that's another reason why we must be very prudent. The fourth reason is spring break. Not next week, but the week after, the week of the 1st of March. This is March break. And when we look, it's almost in Quebecers' habits and behaviors. When there's a March break, a lot of parents take the week off to be with their children, and there's all sorts of gatherings, and we don't want to see what happened during the holidays, where we see an explosion in the number of cases because people gathered. All of this to say that we had a lot of discussions over the last few days with public health, and we said that we had to be more prudent than less prudent. And so we will wait before we open things up too much. So I'm announcing today that next Monday, the 22nd of February, the only region that will go from red to orange is the Outaouais region. Why? Because the Outaouais region has, over the past few weeks, a stabilized situation. We've also checked the situation in Ottawa on the other side of the river, and it's also stable there. But all of the other regions that are in the red, that means Montreal, Laval, Laurentians, Lanaudière, Montérégie, Mauricie, Centre du Québec, Estrie, Capitale-Nationale, and Chaudière-Appalaches, out of prudence, will remain in the red zone for the time being. However, we had a lot of discussions because I'm putting myself in the shoes of parents for March break. I remember when my children were young, we have to find activities for children during the week. I remember this quite well, my two sons, who would say, "Dad, Mom, what are we doing today?" So there are a lot of parents who will experience this the week of March 1st. So with public health, in order to accommodate parents, we've made some efforts, and I'm announcing that as of next Friday, so Friday the 26th of February, movie theaters will be open in the red zones. So throughout Quebec, movie theaters were already open in the orange zones. Second, indoor sports will be permitted for families and for two people. That means, for example, arenas, indoor pools. Families will be able to go while respecting the measures. Outside, outdoors, up until now, it was a maximum of 4 people to do activities together, and now it's going to be 8 people who will be able to, for example, go play together outdoors. And we had already announced this last week. Museums and libraries are open. So it gives you a short list of activities to keep children busy for a few days. And I would like to say that for movie theaters, you can go see Quebec movies. There's La Déesse des Mots-Chafeux from Anaïs Barbeau-Lavalette, which should be on screens. And there's also the animation film Félix et le Trésor de Morca from Nicolas Lemay. So take advantage and encourage our local producers and actors. Now, a question that came up quite a bit: can we rent a cottage or a hotel room in another region where we don't live? Well, it's not ideal, but it won't be prohibited. But there are 2 main conditions, and they're very important. The most important condition: you must respect family bubbles and respect the curfew, which will remain in place at 8:00 p.m. in the red zones. So that means, concretely, that people can go in another region. They can rent a hotel room, rent a cottage, but just for people who live in the same home, so who are in the same family bubble. And we will ask, and actually there's going to be a press conference over the next few days with Geneviève Guilbeault, we will ask police officers to keep an eye on places where there's a lot of tourism. That means hotels, cottages, and where there's a lot of activities. The objective is to make sure that the public health measures are respected, in particular staying within the same family bubble, respecting the curfew, and restaurants will remain closed. So ideally, you bring your own food when you're going to the cottage or the hotel room. Anyways, restaurants will be closed. The other question that came up quite a bit, and that we debated quite a bit, is the issue of checkpoints. Must we have checkpoints at the Ontario border? Must we have borders between, or checkpoints between orange and red zones? After discussing this, we thought it would be more effective to ask police officers to make sure that both the main measures are respected. That is, the curfew and the family bubbles. That is, that there not be 2 families that are in the same cottage. And we believe that this is more effective than having people at checkpoints. Now, I know that there are a lot of parents who can't take the week off. Their employer doesn't have any won't offer any time off for the week of March 1st. And I'm repeating myself, it's very important. It is not a good idea for children to be babysat by their grandparents. Most of the time, the grandparents are older, of course, and they're more vulnerable when it comes to COVID. So I want to be very clear, that is the last thing that we want to see. And I want to send a call to employers. I want to ask employers to be accommodating, to be flexible. So if you have an employee who has children who are off of school for March break, if you are able to, I know that there are some businesses who can't do this, but if you are able to, please accommodate them and give them the time off for the week or part of the week at least, and that would be very appreciated. So I'm asking for the collaboration of employers. And actually, we're talking about 5 business days from the 1st to the 5th of March. So please help parents. I will conclude by telling you that the most important thing over the next few weeks is to make sure that there are no visits in homes. I'm repeating myself, and we had said this previously, everywhere in Quebec, even in the orange zones. Home visits are not permitted, except if it's a person who is living alone. They may be visited by one other person. That is all. We cannot have parties or have suppers with friends, unfortunately. And the police officers, we've already said this, they're no longer just giving warnings. Now they are giving tickets. And they're giving approximately 1,000 fines, tickets per week. And the fines are $1,500. So if you are in a home or in a hotel room or in a cottage with people who don't have the same address as you do, well, there is a risk that you may get a $1,500 ticket. Obviously, we're not doing this for fun. It's because we truly have to be careful over the next few weeks. So I will close by telling you that we have a few difficult weeks ahead of us. Spring is coming, but if we want a beautiful spring, we need to be careful with visits in homes for the next few weeks. Otherwise, I wish you all a wonderful evening, and we hope to have an early spring.
Good evening, everyone. The situation is improving, but our battle against the virus is not over. We still have significant risk ahead of us. There are nearly 800 COVID patients in our hospitals. Our nurses have been fighting the virus for 11 months now, and there's the danger of variants which are even more contagious. With the March break coming up, we have to wait before turning other regions from red to orange. There's one exception, the region of Outaouais, where the situation is stable. For other regions, we have to stay careful and wait after March break. But after discussions with public health authorities, we've decided to reopen certain activities starting February 26. Movie theaters will reopen in red zones, will allow activities for families in arenas and swimming pools, and will allow outside gatherings of up to 8 people. This will allow parents to do activities with their children during March break. The most important thing is to stay in your family bubble. We don't want people renting houses with other families. I know some parents will have to work during March break. I repeat that it's not a good idea to ask grandparents to babysit children. So I ask employers to be understanding with them. Please give them a few days off if you can. We still have difficult weeks ahead of us, but spring is coming. But if we want to improve the situation, we must avoid gatherings in houses for the next few weeks. Thank you all.
Merci, Monsieur le Premier ministre.
Thank you, Mr. Premier. Mr. Legault, Mr. Dubé, and Dr. Arruda will now take your questions.
D'abord en français,
First in
ensuite
French,
en anglais.
and then in
Patrice
English.
Bergeron, La Presse canadienne.
Patrice Bergeron, La Presse
Bonjour à vous
canadienne.
trois.
Question. Hello.
Monsieur le Premier ministre, vous,
Mr. Premier,
vous dites qu'on a encore donc,
You're
des
saying that we
difficiles
still
devant
have some
nous,
difficult weeks ahead of us,
et, vous dites qu'il faut être encore
and you're
prudent,
saying
mais
that
vous
we
permettez des
still must remain
allègements,
prudent, but you're allowing some easing of measures. What are Quebecers to understand from this message? If you say that we must be much more strict, it's going to be difficult, but you're allowing a lot more flexibility in the weeks to come. Well, listen, what we are saying is that we're keeping the curfew at 8 p.m., and it's been very effective because people, of course, it's more difficult for them to go visit other people's homes when they have to come back home by 8. We also make sure that the police officers are keeping an eye on this so that there's no mixing between several families in homes. That is remaining. Now, children are on vacation the week of March 1st, so to allow certain activities like going to the movie theater but while wearing a mask, to go do indoor sports but with a family bubble, to go to the library, to do a few activities, ideally, and as much as possible outside, outdoors. I think that it's a question of balance, a question of mental health for the children and the parents. At some point, we can't think that parents will all keep their children in the home for an entire week. You also talked about the possibility for a person who's alone to visit another person, as is already allowed. I'll bring you back to the holiday period where one lone person could visit a family or another bubble during spring break. Will that be permitted? Mr. Arruda? What we're aiming for is as few gatherings as possible, but there are some single people, for example, a single mother who's got children, who may join another bubble. That is the only exception that would be allowed. But I'm telling you quite honestly, this is not to allow gatherings of bubbles between families. It's truly under certain conditions. People who are single, who need help and all this, that's the same situation as we've always said. But we want to avoid babysitting by grandparents or elderly people, and we want to avoid that certain subpopulations who are more isolated so that they can benefit from the help of another person. Question? I would like to know, what are the forecasts linked to the spring break? What are the models? Because when you're preparing measures such as these, you know what you're expecting. Before Christmas, you knew that there would probably be some illegal gatherings that would probably increase the cases, and that's exactly what happened. Now for March break. Are you expecting to have a slight increase in cases after spring break? Do you expect that we'll be at a plateau? What are you expecting with the measures that you're announcing today? Because I imagine that the decline in cases will not continue. Well, that's a good question. But the models are variable according to how well people respect the measures. We must understand that, yes, there is a March break, but school will be closed, and we know that sometimes there is transmission in schools. If people stay within their bubble, if people respect the measures, if people do activities mainly outdoors, we should not see a significant increase in cases. The difference, perhaps, with the holidays, if you'll allow me, is that during the holidays, yes, there are more gatherings. You know, people want to see each other. It's a holiday period. Christmas, New Year's. During spring break, there may be some activities with two families, etc., but if people respect the measures, we should not see a significant increase as we saw in the past. But once again, it always depends on the respect of the measures. It's not just March break that is dangerous, it's the behaviors of people. And when you say that we're easing measures, we're not easing much. Most of the regions are remaining red, but we are allowing for March break week in order to attain a balance, access to outdoor activities that are not as risky. In an arena, if there's no hockey games going on, the risk is is quite low. In a pool, if we control things, the risk is low. So we're allowing families, instead of just being trapped inside their house, they can go outside, they can take advantage of these activities, which will allow people to really enjoy their week. My second question, just a quick point, unless there's a significant change, tomorrow you'll have a lot of answers from the INES and the INSPQ on the modeling with the variants, because I think that's important. Every week we give you information for the modeling of the hospitalizations. Given all the questions that there were on variants, we asked the people at the INSPQ to come present Dr. Brisson's work tomorrow. So I don't know if the time has been confirmed yet, but that will answer many of your questions, because in the model that's been developed, we do simulations with optimistic and pessimistic rates of what's going to happen during March break. So I think you'll have a lot more information on this tomorrow. Before asking my second question, you did not tell us how many confirmed variant cases there were currently. But I will ask you my second question. You're entitled to. And I hope that I'll get an answer to both. I would like to know, we're recruiting abroad a lot of nurses, 1,700 who will be recruited abroad, and 200 orderlies. That's 5 times more than in previous years. So is that because there are too many nurses who have left the profession, there are too many retirements, or too overwhelmed by the pandemic? Can you explain to us why this year, why you need to go get this many nurses abroad? Well, I can give you part of the answer. But we've been saying for a long time that there are nurses missing, and we had nurses missing before the pandemic, so we've got an issue there. I think that we have people who, even if we had the right number of nurses or the right staff, they're exhausted. So if we can give them vacation and give them longer vacation, regardless, I think it's the right thing to be recruiting right now. I would also like to say that, and this is among the good news, and it's not going to change our recruiting practices, over the past 5 weeks, it's more than 2,000 nurses that we've brought back into the network. You'll remember a little over a month ago, we had close to 7,000 people who were absent from work for all sorts of reasons, and now we're down to a little below 5,000. So that's very good news. But to answer your question specifically, we will continue to recruit in order to have more nursing staff in our network. Now, to your question on variants, we said that we were going to be very transparent, and I would like Dr. Arruda to add to this, but I have committed to being very transparent once a week, minimally, to give you the information on the variants. So what we will do as of this week, and we will continue tonight, we'll start tonight, we'll give you the number of confirmed cases, which right now is 16 confirmed cases of the variant, but what we will also tell you is right now, following the different calls that I've had with Dr. Arruda, with, amongst others, the public health group in Montreal with Mrs. Drouin and Laval, because these are 2 main regions. When I talked about the Greater Montreal region, we're talking about both these regions. Right now, there are being analyzed or being sequenced. So we take our positive tests, and we say from these tests, how many were sequenced. We've got 86 cases that are being analyzed right now, and that's for the last 5 days. So that tells you, it doesn't tell us that there's 86 cases of confirmed variants. They're not yet confirmed. We will call them probable cases. And this is a type of information that we will be very transparent with. And we will tell you, because when we met last time, we were talking about 16 confirmed cases that were confirmed through sequencing. Now that we've got more information with the sequencing, I'm telling you 86 cases are currently being analyzed. But in the meantime, and that's where I would like Dr. Arruda to step in, what I have asked for, and I was very comforted by Dr. Drouin's and Dr. Trépannier's answers, they told us that even if it's only through sequencing that we get this information, even if it's not yet completely sequenced, we act on these cases as if they were new variants. So we do specific isolation for these people in order to make sure that when it's confirmed, because usually the rate of confirmation is quite high between what was seen through the sequencing. So we treat them like they're cases of the variant. Question? I want to add to this. The Simon Fraser Institute yesterday published a report saying that with the variants, there's a potential of explosion of cases of 4,000 by mid-April. With what you're announcing as measures, you're not worried? Well, we have to understand that the variants, when they show up, they replace other strains. If we've got a very contagious strain in that we can't control it, if we don't do intensive tracing, etc., well, we see a quick explosion of cases. Currently, we're continuing to see a decline in Quebec. I'm not saying that there are no variants. We just told you that there's probably 86 cases that are being sequenced, and they will be confirmed later on. And that's out of 925 positive cases. So I think that, yes, it's a risk, but we must understand that vaccination is coming soon. We have to take that into consideration. And we know that vaccination will reduce, and we're already seeing the effects of this with the people in the CHSLDs, RPAs, etc. So the vaccination is a significant element. And the activity, and I want to tell you, independently of sequencing, as soon as we think that there's a very contagious strain, let's say we've got a situation where there are 3 cases and the next day we're at 20-something cases, we intervene as if it was a variant. Because to date, we know the UK variant, the Brazil variant, etc. But nothing can tell us that we won't have a variant that will emerge in Quebec. So yes, if the measures are not respected, actually the variant will not jump on people if there's no transmission. That's why it's important to maintain the measures in place. And in the countries where it occurred, the cases exploded, but quickly the interventions allowed to control the outbreaks. So I think that there are hypotheses, and we've got some curves. You'll see them tomorrow. The graphics will be presented to you tomorrow. But the most important thing is respecting measures. You will see this. There are some models that will be presented to you tomorrow. There are hypotheses of the import of variant or not, but it's truly the adoption of the healthcare measures. If people respect the measures, and there is a strong proportion of people who respect the measures, well, then the virus cannot be transmitted. I'd like to add to what Dr. Arruda just said. Currently, there's 86 cases that are being analyzed, but we have to be careful with the denominator, because when we say that it's out of 900 cases, in certain cases it would give the impression that it's 10% of the cases, but the denominator is not yet confirmed. I'll give you an example. In the cases that were sent to the CUSUM, for example, it's cases from Stanislas. Well, we took a very strong outbreak where there were some cases, and I'd rather wait. I'm giving you the example. When we talked with Laval yesterday, the percentage of positive cases is closer to 2 to 3% than 10%. So I want to be careful. I want to have a bigger sampling. I think that in the next week, and that is what I had committed to give you answers to, by Friday, will we have 75% or 100% of all of our cases that will be sequenced? I think we'll be close to it, but what's important is what percentage of positive cases become variants. I'll give you the example with Laval. The Greater Laval region, we're closer to 3%, so we have to be careful. We have to have a sampling that is big enough. Mr. Premier, there's fatigue, people are fed up. The tone of "I give you this, and this will happen," is that still working, given that Quebecers are really fed up? I understand that people are tired. And I want to tell you that I am as well. I'm very fed up to talk about I'm tired of talking about the pandemic. I would like to talk about something else. But at some point, we don't have a choice. We don't have a choice currently. With the variants, with all the reasons that I mentioned earlier, and the situation in our hospitals, we have no choice but to continue to be careful. We have, luckily, a vaccine that's coming, so we can see the light at the end of the tunnel. Mr. Trudeau is confirming that all of the doses that we're supposed to be getting by the 31st of March will be received, and all the doses, we'll get all the doses we're supposed to get by September, but we have no choice. I understand that people are fed up, but we have no choice. Question? I'm sorry, it's inaudible.
Ou c'est étendu jusqu'à temps que ce soit plus?
Is it until the 7th?
Est-ce que c'est juste pour la semaine de relâche?
Is it just for March break?
Oui.
I understand that it's for good.
Oui, c'est ça. Évidemment.
Unless things change, of course, but
Je pense que la question est plus pour
the question now is more
Je
for...
pense que la situation va être
I think that the situation will be evaluated. I believe that right now we're concentrating around the elements that are going until the end of March break. And I think that a week ahead of time, as we always do, we will reevaluate the situation. And that can mean all sorts of things. Perhaps there are some regions that are red can go to orange, depending on what we will see. And I believe that it's too soon to tell you exactly, but we must be honest. The arrival of vaccines is really what's giving us hope. And I can tell you that I'm really tired of COVID-19 too, like everybody else. But what we have to understand is that now we're really in the last mile of the marathon. We're going... Our healthcare system is recuperating, our resources will need a break at some point, but it's truly, I would tell you, we're in the last kilometers of the marathon. But the more we move forward, the more we'll be able to... the important point is respecting the measures. For example, we opened the shopping centers, we opened all sorts of things, but people can't gather. That's what's important. Respecting the measures will allow us to keep things open and to avoid outbreaks. And that is major. My other question was on sports, organized sports. Organized sports. You've discussed quite a bit with the federations. How can we say, yes, you can go swimming, but a swimming club can't go to the pool? As I said, we have to understand that what we have eased, quote unquote, and some people will think that we're not easing enough, and others will say that we're easing too much given the variants. It's always this balance. This question of balance. We talk about it and talk about it again with the directors and etc. Essentially, there's a break, a March break, and we concentrated on activities where there was a low risk during that week. After, on the 8th of March, it'll be something else. And we are conscious of the negative effects of not allowing young people to do sports, to play hockey. I can tell you that we are reminded of this and we think about this every day, but right now we're concentrating on spring break. We are giving some activities with the easing of measures of movie theaters, indoor sports, for some activities, pools, etc. But afterwards, we will reevaluate. Question? Mr. Premier, there are two specialists, some renowned researchers in Quebec, Dr. Covingard, who is denouncing the lack of financing linked to research on vaccines. He says that we had a vaccine that was being developed. If we had had money from the federal government, but it was refused, we could have launched it. Dr. Denis Leclerc, during the holidays, he's another researcher at the University of Montreal. He said, why don't we create a research center on vaccines in Quebec in order to stop this dependence that we have on international companies or on the federal government who negotiates with these companies? Is this something that you are thinking about, Mr. Legault, to finance a type of vaccine center, let's say, that would allow us to react quickly in the future? I will start, Mr. Lacroix, and then I will let the Premier speak. When we're talking about autonomy in Quebec, I think that it's up to him to answer, but I got a very clear message. I talked about it with the Minister of Industry and Commerce. For me, we have to draw a parallel that's quite simple. We gained our autonomy in protection equipment, in PPEs. You'll remember the decisions that we made right after the first wave. We wanted to make sure that we had manufacturing of our PPEs in Quebec. Like the N95s is a very good example of this. We want to do exactly the same thing because I think that with vaccines it's even more structuring. It's even more important. And I think that when we had our discussions with Dr. Covinger, when we spoke to him, we said we know that the decision to support you will perhaps not allow us to have a vaccine for this pandemic. But we said it doesn't matter. There will be something else. There will be other opportunities. And we're going to put all of our energy, we're going to put all the resources necessary to support him in his research over the next few weeks. To be very clear, we are there.
De façon plus générale, il n'y a pas personne,
Generally speaking, I don't think there's anybody
qu'on soit autonome dans le domaine des médicaments.
who wishes more than I do that we be autonomous when it comes to medication. At some point, there will be things that we'll be able to do. There are some things that are not realistic to do. Tomorrow morning, is Quebec able to have a Pfizer or Moderna or Johnson & Johnson or an AstraZeneca, a company of that size? That's not realistic. We're talking about several billion that we have to invest every year in research. You know, in the history of Quebec, we almost at some point had a pharmaceutical called Biochem Pharma, and the people who were there before me decided at some point that to let it be sold to foreigners. But there was one product at the time. But we have to be reasonable, but honestly, it's an objective of mine. And I've discussed this with Pierre Fitzgibbon, the Minister of the Economy, as much as possible. We want to be autonomous in everything that we need when it comes to health. And that includes medication, and there are many possibilities, many opportunities. If we had had the capacity to manufacture, perhaps we could have convinced one of the big pharmas to let us manufacture the vaccines ourselves. So there are a lot of ways. I heard Québec Solidaire talk about Pharma Quebec. We all agree that we want to be more autonomous, but at some point we have to be realistic and we have to have a strategy that is manageable. But yes, we must be more autonomous in everything that has to do with medical supplies, in medication. We have to be as autonomous as possible, and that is part of our objectives and our priorities. My other question has to do with another topic. The Parti Québécois has used, according to my information, the electoral list to check addresses for the personal addresses of your sons, which goes against the federal law. That is prohibited. The lists are given to the parties so that they can use them during an electoral campaign or for financing. So how do you react to this? Listen, I said everything that I had to say following Paul Saint-Pierre Plamondon's statement. So if you have any questions, you can ask them to Mr. Plamondon. I have nothing else to add.
Fanny Lévesque, La Presse.
Question?
Vous trois. Monsieur Legault,
Hello.
vous avez beaucoup
Mr. Legault,
mis l'accent sur
you put the emphasis quite a bit on we're in this for a few weeks.
Est-ce qu'on doit comprendre qu'il faut tenir
Are we
le
to
coup
understand
jusqu'après la
that we must
relâche et
hold
donc
on
après
until
la relâche,
after
ce serait
March
probable
break,
que
and
les
after
régions
March break,
basculent à leur orange?
some regions may go to orange? Well, listen.
pensais qu'il n'y a pas
If
de
I
chance
thought
que les cinémas restent ouverts,
that there's no chance that movie theaters would stay open, I would not open them because we want to play the yo-yo. But there are some things that we don't control. For instance, the impact of the variants. On the other hand, what's looking good is vaccination.
Si on arrive à être
If
capable,
we
on est rendu dans les RPA, on a fait
now
des
we're
CHSLD,
in the
on a fait une
RPAs,
partie
we've done the
du personnel, si on
CHSLDs,
est
we've
capable de faire
done part of the
toutes les
staff.
RPA, puis
If we can do all the
éventuellement, tous les gens
RPAs
qui
and
ont plus de
eventually all the
65
people
ans,
who are
on
over
ferait être en
65 years of
voiture,
age,
tu sais, puis
well,
on serait capable
we'll be in
d'en
good shape
avoir
and
une
we'll
bonne
be able
partie de
to
ça de
have
fait en mars.
a good
Donc,
portion of these
ça dépend de la
vaccinations
vitesse à
given in
laquelle
March. So it
les
depends at the
vaccins vont
speed
arriver.
at
Est-ce qu'ils
which
vont
the
tous
vaccines will
arriver
arrive.
le
Will they
31
all
mars,
arrive on
ou
the
si
31st
on va
of
en
March,
avoir
or will we
graduellement
get some gradually
pendant tout le mois de mars? Puis
over
comment ça va évoluer?
the month of
là?
March? And how will it
On va
evolve?
vous revenir
We will come back to
comme on
you
le fait actuellement toutes les 2
as we're
semaines.
currently
Ça veut
doing
dire
every
que
2 weeks,
dans
and
la
that means
semaine de
that
relâche, là,
during
probablement,
March break,
le mardi de la semaine de relâche,
probably on
je
the
pense que ça va être
Tuesday
le
of March
2,
break, I think it's going to
ben,
be
on
the
va venir
2nd of
vous
March,
dire
well, we will
ce
come
qu'on-
tell
ce
you
qu'on fait la semaine suivante.
what we're doing the following week.
Mais il y a un bout, là, bien honnêtement, celui
But
qui est
quite
capable
honestly,
de prédire combien on va avoir d'hospitalisations.
If somebody
dans 2
says that
semaines,
they can
là,
predict how many hospitalizations
j'aimerais
we'll
ça
have in 2 weeks,
savoir.
well, I'd like to
Donc,
meet this person.
on fait notre possible.
We're doing our
On
best.
va dans la bonne direction.
We're heading in the right
J'espère que
direction.
les Québécois vont être
I hope that
prudents
Quebecers
dans
will
la
be
semaine de
prudent
relâche,
during
qu'on
March break,
vivra pas
and
ce
that
qu'on
we
a
will
vécu
not
pendant le temps
experience
des
what
fêtes.
we experienced
Si
during
c'est
the
le cas,
holidays. And if that is the
oui,
case,
c'est possible
well,
qu'on
yes,
ouvre
it's
davantage
possible
le 8
that we will
mars.
open more things on the 8th
Et
of
donc,
March.
en précision, c'est la même chose, je comprends,
So
pour le
it's the same thing, I imagine, for the curfew?
Bon. Maintenant, Monsieur
Now,
Dubé, vous parliez
Mr. Dubé,
que vous avez pris l'engagement
you
la
said
semaine
that you
dernière
committed
de-
last week
d'avoir du criblage sur 100% des
to
échantillons positifs
sequencing
dans le Grand Montréal. Donc,
100%
c'est
of
toujours
the
réaliste qu'on arrive à
positive
ça d'ici la
tests
fin
in
de la
Montreal.
semaine.
So is it still
Puis,
realistic
par
that
rapport au
we'll get to that point by the end of the week? And when it comes to the sequencing, we were talking about 8.5% last week. Now, where are we exactly? I'll start with the sequencing. In my discussions, as soon as last night, as recently as last night, I was told that in certain regions, because if we look at Greater Montreal, that's what I committed to, there are some people who are already at 100% of sequencing. Laval, I gave you the example. Montreal is closer to 25 to 30% already. The commitment that was confirmed to me yesterday is that by the end of this week, if everything goes well, all of the cases, all of the positive cases of the week, 75% of them will have been sequenced. I'm asking for more, but they have committed to giving me at least 75% of those cases sequenced by Friday. So that means that if it's at 75% on Friday, it means that they'll be at 100% on Monday, because of the progression. So there's a very clear order. I mentioned it to Dr. Roger this morning as well, with Mylène Drouin and Dr. Trépanier. We've spoken twice since yesterday. Dr. Arruda was with us. We will follow this very closely. Now, when it comes to the sequencing, Dr. Arruda perhaps, well, in the initial phases, 100% of the doses or the cases that will have been detected will be sequenced. So let's say we've got 83 sequenced right now in the initial phases. Well, we will do it for 100% of the cases will be sequenced. That means that if it was 10 days later, then 93 will have been sequenced. If I understand Mrs. Lévesque's question well, it's more to say we are at what percentage of sequencing? We were at 8.5% of our sequencing generally. I don't think that it's evolved that much unless Dr. Arruda, well, we're still at around 8.5. It's going to go up to 10 and 15%, and that's on the totals. But on the ones that we have detected, I don't know if you understand what I mean. On the totals, it's always going to be done randomly to detect new variants, but the ones that were already identified by sequencing, those 100% of those will go to the next sequencing. Thank you. Question?
Monsieur Legault, j'aimerais revenir sur le couvre-feu.
Mr. Legault, I would like to get back to the curfew. You continue to say that it's one of the measures that is the most effective to control the transmission of COVID-19. Are we to believe that this will be one of the last measures that will be lifted in Quebec? Listen, if we were sure that people were not visiting other houses, we wouldn't need a curfew. So it's also a question of, Mr. Laforêt mentioned this earlier, there are some people who are starting to be fed up. So how fed up will they be in a week, in 2 weeks, in 3 weeks? It's difficult to answer your question, but it's clear that it's difficult to control for the government what's happening in homes, right? We can, to a certain extent, kind of control what's happening in schools and businesses, but what's happening in homes, well, it's difficult to control. If we make sure that everybody is home at 8 p.m., well, there are no longer visits in the homes after 8 p.m., right? So it's effective. Thank you. And why not wait until after March break? Why not wait until March break to open movie theaters, open pools? Is there not a risk of gatherings? Well, as I said earlier, I'm putting myself in parents' shoes, right? I was a parent myself. I don't know if you have children, but if you've got 2 or 3 kids, 5, 10 years old, for a week at home, what do you do with the children? You become a bit like an activity person in a Club Med. So the cinema is a good activity, going to the library is a nice activity, playing outside, going to an indoor pool or to the arena. These are activities that can keep kids busy. So it's important, as I was saying, for the mental health of children and parents. And we had good discussions with public health, and public health agrees.
Charles Le Cavalier, oui.
Activités qui sont à moindre risque. C'est ça qu'il faut comprendre.
These are activities that are at lower risk. In movie theaters, we go, we wear our procedural masks, we're sitting at a certain distance from other people, so we consider, there were no outbreaks in movie theaters. So we're opening the activities that have a lower risk. On a big rink that's not super busy, because there will be controlling. We're going to make sure that people are keeping the 2-meter distance. Question?
Alors, pour continuer sur la lancée de mon collègue Carabin,
to add to what my colleague was saying, why movie theaters but not showrooms, theaters? That's a very good question. Because children
vont souhaiter aller voir un film.
Will want to go see movies.
C'est la première chose.
That's the first thing.
Deuxième chose,
the second thing,
salle de spectacle, ça prend
well, a
aussi un
showroom
certain temps.
Takes a certain amount of time, right? We had some discussions with my dear friend, Mr. Guzzo, and all the people who have movie theaters, and we believe that it will be possible for the 26th of February to show some movies, but to do to have a production in a showroom by the 26th of February, which is next Friday, well, it's not very realistic. And I think that we can keep more kids busy with movie theaters. Question?
Mais justement, sur le même sujet,
on the same topic.
Est-ce que ces petits allègements-là pour la semaine de relâche,
these
c'est une demande du politique là,
for
qui
March break,
donner un peu d'air aux familles, ou
is it just to give a bit of oxygen to families, or does it come from public health?
Permettre de répondre, ça vient de la santé publique parce qu'on est
it comes from public health because we are conscious of the fact of the impact that it can have on behaviors. First of all, we prefer that people go do outdoor activities in the Montreal region with 8 people, and we're increasing it to 8 to avoid big indoor gatherings. And we are conscious of the effects on mental health, this need to get a bit of oxygen, and to have different activities for young people. And as I said, we consider that these are low-risk activities. I think that's important because they are activities that are controlled. People sit in the theater. We didn't open Récréatex or places where people can interact with objects and stuff. We're really with low-risk activities here. Dr. Arruda, there are several regions. The Outaouais is going to the orange zone, but there are several regions where the situation is pretty good. Capitale-Nationale and Chaudière-Appalaches were below the thresholds that were set by regional authorities. I understand that it's a variant that is scaring people. But please tell us, and I know that you'll talk about models tomorrow, but please tell us what exactly is the risk in the number of cases, for example, that there can be if we go to orange zone right away in Quebec.
On l'a toujours dit.
We've always said, and this is the danger, if we mention one number and we tell you that's the only number that will work, but I want to tell you that the discussion that we had with the public health directors is unanimous. Apart from the Outaouais region, where there was stability, low rates, etc., few hospitalizations, and Ottawa is on the other side, and they're orange as well. So imagine if people would leave the Outaouais region to go to Ottawa to eat, whereas on our, because on our end it's close. That was discussed. For all the others, we haven't had stability for long enough. We have to take into account the impact on the healthcare system, the capacity of contact tracing, and people really want to go even lower. So if ever the cases start going back up again, we don't find ourselves in situations where we will put in danger the health system. We want to be prudent because of the new variants. There's also a question of looking at what's around us. If we have zones that are too different and they're side by side and there's movements of populations, well, all this will be evaluated, but this was a unanimous decision. We talked about it. Now, in order to be prudent with the new variants, with the zones that have stabilized, even if there are some who technically are in orange because of their numbers, the other factors led to our decision. It's a balance. The number of cases, the number of hospitalizations, the number of outbreaks, the capacity to do contact tracing, and the question of the new variants and what's happening around us. The question, Mr. Legault, your government, does it support Bill C-21 to tighten the control of weapons that was tabled today? Well, the first thing is that we're delegating, which bothers us, is we're delegating powers to the 1,100 municipalities in Quebec. So technically, there would be 1,100 different rules, different bylaws. Well, we're ready to take on this power. The more powers we get from Ottawa, the more we like it. But we've got a big problem with the fact that the powers would be delegated to municipalities, given the great number of municipalities we have. And I think it should be the same thing for everybody. Now, when it comes to this bill, is it enough? Well, it's a step in the right direction. But we see a serious problem with the delegation of power. We will now go to the English questions.
Good evening. A little precision for Dr. Arruda or Mr. Dubé. 16 confirmed variants, 86 likely suspected. Can you tell us where the 86 mostly are? And is it still the UK variant? Are there any other ones that have appeared now that you're screening so closely?
I'll answer yes to both questions, mostly in Montreal and mostly UK. And Dr. Arruda can confirm, but I think that those are the discussion we had last night with Dr. Drouin and Dr. Trépanier of Laval, but mostly to both of your questions.
And your screening level in Montreal is still between 25 and 30%?
Well, it's too early to put a percentage because we're looking at the last 5 days. We're looking at certain screening, criblage screening, just want to make sure that has been done, some by the CUSUM, some are still to be expected by the CHUM. So I think it's too early to, how do we say, the denominator. We know that the 86 is good, but we don't know how many positive cases. So I would be prudent to put a percentage. The only percentage that we agree on is approximately 3% in Laval. But I think more than that, this is the reason
Positive, you mean?
Yes, that's right. So if in Laval they have, I'll give you an example. They had 60 cases yesterday, positive cases in Laval. If they have a 3% positive new variant, they would have roughly 2 cases that are probable cases to be confirmed by sequencing. Okay?
And to follow up on Mr. Lecavalier's question, you've said that the risk, Premier, there's still risk out there. There's still a lot of risk. Are you sending a mixed message to the public? because some people, the average person will see, okay, movie theaters are opening up, we can go to the pool, maybe they're going to let loose, and it'll be too loose. And does that not represent a serious challenge to control the variants and the pandemic?
Okay. What I understand, and maybe the question can be completed by Dr. Arruda, is that the risk we see is really in houses. People meeting other people and transmitting the virus. So if you have, let's say, 50 people in a movie theater place with masks at 2 meters from each other, the risk is not very high. But if you start having people visiting other people in houses, there's risk. And that's why I'm asking all Quebecers, be careful. If we want to continue to give chances to people to see each other, you have to be careful what's happening in houses.
That's exactly the case. That's really the thing. It's places where the risk is monitored, because there are people looking, making you sit over there and over there. It's not crowding places in that way. It's going to be the same thing for arenas, and it's going to be the same thing for swimming pools.
And that's why we keep the curfew at 8 p.m. in red zones. It's efficient to make sure people don't meet with other people in houses.
Maya Johnson, CTV.
Good evening. Premier Legault, you were just talking about the high risk of transmission in private homes. Earlier you said spring is coming, and I detect in that you're trying to give Quebecers a sense of hope. There's a new season, and we're going to get through this, but there's still a bit of time to go. So what targets do we have to reach before we can entertain the possibility of going into other people's homes? Or is it too soon to establish a target because it's a moving target given the variants? You're trying to give people hope, but we don't have any clarity.
Yeah, but of course we have many elements where it can move. You have the variants, you have what's happening in our hospitals in each region, and of course what's happening with vaccines. Because if we succeed in the next few weeks to have all vulnerable people vaccinated, it will be a complete new ball game. And then you would be able to start thinking about starting meeting other people in home houses. So the vaccine is very key. What's happening with the variant also is key. So unfortunately, we don't control all those risks.
Just a follow-up question. We're approaching 1 year since we went into that full lockdown and we put Quebec on pause. Is there a possibility of doing that again?
I hope not. I hope not. And I think that it's incredible when you think that before 1 year, large companies were able to find a vaccine. It's incredible. So now it's a question, it's a matter of months before everybody be vaccinated. So if you don't have new virus, it'll be okay.
Cathy Sonnet, CBC.
Good day. You have community groups and also a city councillor in Montreal asking, putting pressure to have race-based data to see which communities are the most affected by COVID-19. And also you have the National Advisory Committee on Immunization trying to convince authorities to have racialized communities to be vaccinated because they are vulnerable. What do you think about this? Shall we have race-based data, and shall we put a racialized community as a priority to be vaccinated?
I think the issue about race is always a little bit complex because it's not the fact that this is a race, it's the fact of the conditions of the person who live. And I think that this information is available for I would say, like for Montreal, for the public health of Montreal. They know exactly which are their communities, and even they translate information in different languages. They work with the Red Cross, with the Fondation Trottier to adapt their intervention to that. I think that we use that sometimes for some diseases where there is a racial effect of the disease because of the genetics. But most of the time, it's not the race which is the problem. It's the conditions of the person, poverty, crowding in houses. And I think it's why it's those elements that are more important for me, which is the revenue, which is the how many kids, the university level. For me, that's the factors that can affect and explain why those communities are more disease and more side effects.
Just to clarify your point, Mr. Legault, you said that you're reopening basically cinemas for kids, but then you're not reopening at the same time theaters or concert halls. Don't you want to send a message to adults like 65 years and older to hang on and to send them a message of hope, because they're really getting tired of the whole situation and feeling that we have to protect them all the time?
Yeah. For me, the risk in a theater and in a cinema are quite similar, all right? Reason why we choose the cinemas is because we have many children, I think it's 1 million, that will be in vacation for 1 week on March 1st week. So we have to limit the number of openings, and we choose the one that is helping families. But I want to reopen all the theaters. Of course, it's longer to prepare a new show than to get a movie from wherever.
Raquel Fletcher, Global.
Good evening. I wanted to return to a question that one of my colleagues asked in French earlier about what your expectations are coming out of the March break. She mentioned that at Christmas we had certain expectations that we were going to see the numbers increase. And I'm wondering if you can tell us where your projections are right now, because you said that you don't want to have this yo-yo effect where we reopen cinemas and then we realize, oh, okay, in a couple of weeks we have to close them down. But that might be the case if people do get together during this break. So how can we counter that, I guess is my question.
Yeah, but this is the reason, again, just for very high transparency, that we're having this briefing tomorrow morning with INSPQ and Dr. Brisson. Because what we ask him, and we ask this question every week, but in light of the variants, we said, give us simulation, and we'll make that public tomorrow. What are the simulation, including the week of, I forgot the relâche. How do we say relâche? The spring break. Spring break. Sorry, I had a blank. So we asked Dr. Brisson and his team to give you the sort of curves that we see the same way when we look at those curves for hospitalization. We ask him the same thing. What happened if this happened in the spring break? Or are we optimistic? Are we, normal? Or are we really pessimistic? So you'll have all that information. And one of the things that lead the discussion on variants, at what rate do we get those new variants? In countries that we have looked at, in Ireland, in UK, it's very clear that if the variants are limited very at the beginning and the right measure of confinement are done, countries have been able to limit the impact of those variants. And this is the reason we're saying not only we have the vaccine, but let's make sure that we keep those measures, those sanitary measures, very clear. So you'll have those simulations tomorrow morning. I think I don't have the precise time, but you'll get the warning. That is very important to answer your question tomorrow.
I would add one important difference between Christmas and March break. It's the curfew. At Christmas, we didn't have the curfew. I think that with the curfew at 8 p.m., definitely it reduced the number of contacts.
My second question is about the 1,700 nurses that you are recruiting abroad. I know you were asked in French, but in English, can you explain why this is necessary?
Well, because first, as I said, our nurses, and I would say in general, our employees are tired. They had a terrible year, and we all know that. So even though we have some good news, and some of those good news is we got back about 2,000 of them over the last 5 weeks. That's very good news. We had been able to increase the number of students at the deck back that we call. Almost 500 of them decided to postpone their study for 1 or 2 sessions and come. In addition, if we hire people coming from abroad, I think it's a combination of factors that we want to make sure that we have as many employees, as many nurses in our personnel. So we'll continue hiring because they had a tough year. So if we can give them additional holidays, I think they mostly deserve it for sure.
Avant de mettre fin au point de presse, je vais
Before we end the press conference, I will ask a question from Alison Lampard from Reuters for the Premier. She would like to know your reaction to the update of Transat when it comes to the arrangement with Air Canada. She is wondering if you are worried that the buyback of Transat by Air Canada could be cancelled at any time given the situation, the financial situation. You want me to answer in French or in English? The question was in French. Well, listen, yes. I've got some worries. We had some discussions last night with the concerned persons, so there is a possibility that the agreement between Air Transat and Air Canada will not be respected, or we may not get to closing. And it's even more important that we look at other alternatives, but we will not let down Air Transat, that's for sure. We are looking at different scenarios, whether it's with or without Air Canada, but Air Transat is a very important company in Quebec, and whether it's Pierre-Carl Pelado or other people who have manifested an interest in this file, we're following it very closely. And
parle avec beaucoup d'intervenants.
Très bien, c'est ce qui met fin à cette conférence de presse.
Merci beaucoup tout le monde.